Good afternoon. Welcome to Instagram Live on this beautiful Wednesday with Dr. Carmen Calfa. And please tune in while we are waiting for her to join us. And I'm so excited to have her on today to talk about breast cancer. I have totally learned over the last couple of years through Rock Strong, survivorship is often not spoken about enough. And with Dr. Calfa, they have some absolutely fantastic programs that they offer and how far breast cancer has come and the difference in the stats over time. So welcome, Dr. Carmen Calfa. How are you?
How are you?
How are you?
I
Welcome.
think I got it. Yes, I just needed an invitation. Now I was able to join.
Perfect. I'm glad. So welcome.
Can
Thank you
can you
so
hear me
much
okay?
again. Yep, I can hear you perfect. So welcome everybody. Thank you for joining today's Instagram Live as we have Dr. Carmen Calfa, a breast oncologist, joining us today to talk about survivorship and the differences that and how far breast cancer has come over the years as women often go through treatment and forget about or don't know about what there is offered to survivors. So here we are with Dr. Calfa, who's going to open up, introduce herself, and share some amazing information.
Thank you, Tracy. Hi, everybody. Happy Survivorship Month, and I hope everybody's enjoying, survivorship every day. All those diagnosed and affected by cancer. I think it's a lot that we have learned, and we're able to have survivors living better lives. But I'm passionate about that. I made it my mission to not only help women conquer and hopefully cure as many breast cancers as we can, but also create the lives ahead that they really want and regain everything more from what they had from day one. So I am Carmen Calfa. I'm a breast medical oncologist at the Sylvester Comprehensive Cancer Center. I'm the associate director for community outreach, and that's how I got to meet Tracy, who's doing beautiful work in our community. And I recently joined as a medical director for clinical operation for survivorship program at Sylvester. We are obviously privileged to have a team of people that we feel and we work with. It's like a big family caring for our patients and our community together. So I really appreciate the opportunity to having you all today join us, and I'm here to share with you everything that you want to know. I can just share with you what's going on now and where we are from, where we're coming from in terms of breast cancer treatments, in terms of research, in terms of what we offer at Sylvester, and also the fact that I was talking to Tracy yesterday, and we're talking about how patients are encouraged to get a second opinion, right, when you're diagnosed with a breast cancer. And I said, it's almost, I feel the same when as a survivor, you deserve the same resources and the same information and the same abilities to really navigate through. Just like when initially diagnosed, you go and you look for the best team to take care of you and give you the best chance to be alive and beat breast cancer. You want to reassess that, whatever you are in the treatment, and to really look for even a second opinion, to look to see what else can you do to live the life that you really want to have, and what are the things that cancer had caused, what are the things that the treatment have caused, and where you're coming from and where you want to be. So I hope I can answer all the questions that you all have, and I'm going to pause for a second just to hear the thoughts from the lovely people that I see that are saying hi to us. So thanks again for having me.
Anytime as we are sitting here and women are tuning in and their families, all I hear is, thanks, Dr. Kalfa, you saved my life. Thanks, Dr. Kalfa, you saved my life. So thank you everybody for tuning in. As you know, it's always good to see our physicians on the other side and get to know them and hear their points. And, one thing that I enjoy really working with Dr. Calvin about is the survivorship program. I will never forget one of our women called us and was telling me how miserable she was at the center. And I said to her, I have a better place for you where you might feel comfortable. Go for a second opinion. And she went and she saw you. And when she was done with her treatment, her surgeries, she's like, what's next? And I said, call Dr. Calfa and talk about her survivorship program. And she said to this day, it's the best program she's ever entered. And it's really changed her life. Things we don't think about as survivors, and I'm going to remove myself because obviously I'm a survivor, but hearing in our community is, you know, how do we go back to the normal that we were prior to treatment? What are some mind and body and soul? How can I work through it? You know, is it through acupuncture? Is it through communicating with other survivors? You know, what are ways that we can help? And the program that you guys offer, I just think is amazing, you know, from Dr. Rojas and sex therapy, you know, to finishing with you, to going on to all the other services you offer. So when we talk about survivorship and the different programs, I want women to know at different centers there is availabilities. You know, at the center Dr. Calfa's at is amazing. They happen to have a fantastic program. Not everybody has that, but within your community, you can find some kind of support. And if you can't, come to Braca Strong, and we will connect you with those physicians and doctors, because once you finish surgery or treatment, your journey is not over. It's survivorship, right?
Yeah. So Tracy, this is a great, obviously, we met, Tracy and I and us at Sylvester, we met based on common values and common goals. You know, I did not promote her services and she didn't promote mine just because we go have coffee together. It's just because we really feel that what we have and what we can, it's something that many will benefit and few, relatively few still know about. So I just wanted to talk about a little bit about survivorship, right? Because I hear many ways that people think about that. And some people feel like they should just be alive, just be grateful that they're alive and should just put up with whatever it comes with. Some people think that survivorship, you know, defines a certain population and they are not included. So I'm just going to talk about a few things, what this survivorship is, you know, that we want to define it and to share with patients and caregivers the resources that we have available for them. So by definition, survivorship starts the day of diagnosis, right? And it ends when somebody dies. So from the day someone is diagnosed with cancer, we define that as survivorship. And it believes it or not, it includes, as it should, the caregivers and the family. So it's not a journey of one individual, right? And it does affect the family and the caregivers. So the definition of survivorship includes those. And we really try to address their needs as well, as much as the patient itself or himself. The other thing about survivorship, it does not care about stage 0 or stage 4. Once diagnosed, you're a survivor. And there are different levels of survivorship. You know, those that live with advanced cancer have a different level of survivorship and different needs than those that are diagnosed with stage 0, you know, that they are survivors as well. So anyone diagnosed with cancer, it's a survivor. And I call survivorship the gift that keeps on giving. It does affect the person and the family. And most of the time, it's from head to toe, literally. And I know I have some friends that join us on Instagram. And I know we talk about in clinic. And I don't say it, you know, from the mind that gets, you know, trapped into this, you know, either fear of recurrence or anxiety that comes with the cancer diagnosis.
Ooh, we lost you. You froze. Just bear with us, guys. The internet is going in and out on Dr. Kalfa's side, so just bear with us and she'll be right back. Dr. Kalfa, maybe you want to go in and come back. Just bear with us, guys. And Rosemary, I will get your question answered. Just bear with us as we're having some technical difficulties. Again, everybody, just stay tuned and we'll be right back. Oh, you're back.
Me?
Yes, we can see you now.
Is it still in and out?
No, it's perfect. Now I can hear you.
Yeah, the weather is not good, so I just went on LTE without Wi-Fi, and I think it's better. text me if it's not working well, and I'm sorry about that. So, I was saying that it affects the individual from head to toe, and I'm just going to focus a second on the mind and on the emotional health. Right? We know that the cancer diagnosis is really, it's really impactful, right? And we know that once a patient is diagnosed, there's, a lot of implications for their emotional health. So it does cause a lot of anxiety. It's associated with depression. Many patients have PTSD, post-traumatic stress disorder. So we really pay attention to that, and we have psycho-oncologists specialized in addressing these needs. That's the head itself, right? Not to talk about the hair loss, not to talk about the eyebrows, not to talk about what it does to the skin, to the mouth. And then you go to the body changes, the body image, the sexuality, everything that the breast cancer, does. Most of the cancers are estrogen receptor positive, therefore the treatment will involve anti-estrogen, will involve removing a part or full mastectomies, so it will change the way that the woman feels and looks. So rebuilding that confidence around and recreating, everything that was lost in a different way. It takes a team of experts that are passionate about that. But women do find the strength that they need, and they find somehow themselves even in the same version or a better version of themselves. And having the right team in place and the right support, you can thrive as a survivor. And it's not a cliche. It's really something that we're passionate about. We want to make survivors that live forever and thrive and have best lives that they can ever imagine. And then what else cancer does, and the treatment of cancer. It can affect the heart, so we have a cardio oncology program. It can affect the bones, so you need to take care of the bones. We're going to put women in early menopause. We're going to have to pay attention to the bones. There are medications that not only improve the bone health but also improve the cure rate. We have nutritionists that are helping us to really do the right diets for the right type of cancer the patient diagnosed, and dismiss a lot of myths, that are there. We have exercise physiologists that, can you hear me, Tracy? I see a message from you. Can you hear me okay?
Yeah.
We
Nope.
have
I can hear you.
exercise physiologists that are working with our patients one-on-one. We're able to provide that even through COVID on telehealth. So our patients, even though they're limited in the places they could actually go out and move, they're able to use that service, at their homes, in their rooms, and work with an exercise physiologist, because we know that exercise and diet is as powerful as the best treatments I can ever give to some cancer types. We know the most recent research showed that it's a 64% reduction in breast cancer recurrence rate for those with estrogen receptor positive patients with breast cancer. So how much do I quote the benefit from my chemo and endocrine treatment? It's about 65%. So if I were to add that to the benefits that somebody will receive from chemo and endocrine treatment, you get them most of the patients cure. And then for those that are unfortunate that the cancer does recur or it presents in stage 4 to begin with, there are so many treatments that we have available and so many clinical trials that are able to join here at Sylvester. Or if not, we're helping them to connect. Today I sent 2 patients to be evaluated at the NIH for, trials that we don't have here. First in humans, even though we have a phase 1, there are others that are not here, but I'm helping them to reach out and find it wherever that is. So with all being said, I'm just pointing out that we are here to, treat and cure as many breast cancers as we can. Obviously, to diagnose as early as possible they can be, because that leads to the highest cure rate. In addition to that, to help those living with stage 4 to live the longest, happiest lives. And Tracy, the 2 things that I'm really not 2, because there are many, but they're somehow related. So precision medicine is now something that we talk about more, but it's kind of the medicine that we practice for a long time. When you think about using tamoxifen for an estrogen receptor breast cancer, that was precision, right? It was finding something that the cancer would be susceptible to. But now we talk more about it, and it's at a different level. And I'm just gonna share the latest that is being done. So when patients, especially those living with advanced cancer, when you sequence, the tumors and you look at the molecular uh, pathways that are making that cell probably replicate and migrate and move to another organ, we're trying to find if there is any of those mutations that potentially could be actionable. And, that's in a sense what we mean by precision oncology, trying to find something in the tumor that makes it more likely to respond to an targeted intervention. And I compare that, and I know it's not a fun comparison, but in a way it's true. I say, if you had a car coming full speed at you and you try to stop that car, it would be very difficult. It will take a lot of damage to stop it by using force, right? Or something non-specific. But if you only knew where that brake was with a gentle touch, you are actually able to stop it. And that's kind of the idea behind precision medicine, finding those pathways and then trying to have drugs to block those pathways and impact patients' lives through that mechanism that will be very specific, very targeted, and relatively non-toxic. And we do have an ASCO, which is the American Society of Clinical Oncology, first led clinical trial that was looking to really create these opportunities for the patients wherever they are at their homes. We're the only site in Florida for now, but that study has partnered, that the organization ASCO has partnered with pharmaceutical companies, and they said, well, we're going to give you the drugs for free if you create this clinical trial where patient can be monitored and we can all learn what works and what doesn't work so more can benefit from it. So that's in a nutshell precision medicine, and some of the things that we're really passionate at Sylvester, and some of the things that patient can come, and they do come from everywhere, to be a part of if they live with incurable cancer of any kind. It doesn't have to be breast. It could be any kind of cancer. And some of the hematological malignancies are included as well. So, lots to talk about, lots of clinical trials going. Over the last 3 decades, there are like about 40% reduction in the risk of dying from breast cancer because people do join clinical trials and because people take the leap of faith and say, as long as I'm not taking nothing and you're taking a standard of care, then the comparison potentially could be better than standard of care. And that's what when participants agree to go on a clinical trial, and that's how progress has been made. So ask me questions, anything you want to know.
Let's see. So Rosemary from 305 Ping Pack, who I'm going to connect you with, is amazing. They do rides to chemo, and I know that she's helped some of your patients. She's asking, do women who do not have an end date for treatment qualify for a survivorship program?
That's a very good question, and that's the survivorship that I talk about, the permanent survivorship, and they do qualify for survivorship program. Yes, they do.
So, how do women find more about, the survivorship program at Sylvester? Is it on the website? Can people just?
Yeah, so on the sylvester.org, you're going to find a whole page about survivorship. There is research about survivorship. There are activities that we do. For our patients, we even have Monday through Friday, several times a day, different sessions that can join, and they can participate virtually. The survivorship program is mostly, is right now for the patients that are treated as Sylvester. But for a patient to become one of our patients, they could be at any time during their journey. They don't have to require active treatment. They could be 5 years away from the treatment or in the middle of the treatment. If they want to be part of the Sylvester family and team, they're welcome to join us. Otherwise, it would be very difficult to just include them in our survivorship without having them seen by one of our oncologists. The reason is that you have restrictions depending on their medical comorbidities and their areas that are affected by cancer. So it would need to be their medical oncologist or one of our oncologists to see them, and then they will be able to join any of our survivorship programs.
Amazing. I do want to go back and talk about clinical trials a little bit as we speak about them, for survivors that weren't offered clinical trials due to whatever reason. But as we're trying to gain more knowledge on different ethnicities, different backgrounds, maybe you just want to explain a little bit on why women who are survivors or who are just diagnosed really should join clinical trials. Because I truly feel that there's a big misconception and
Yeah,
women don't understand that we need the data, right? We need data on African American Black women. We need data on, from Russia, from all over the world. We need different stats. But I hear still now to this day, some women are like, I don't want to be a guinea pig. And I feel like it's not about being a guinea pig. It's about helping yourself and helping the next generation, your children, their children, because that's really how advancements in medicine happen, right? Is
yeah,
by collecting our data. So maybe if you want to just talk about a little bit about like why we should be so involved in clinical trials and
yeah.
there's a purpose.
I agree with you, Tracy, and I'm glad you're bringing that because ASCO's mission, especially this year, it's always been to reach the patients everywhere and to make these, innovative treatments available to every patient everywhere, every day. And that's really our mission as well. We are the only NCI designated cancer center in South Florida, and we have trials that otherwise you wouldn't find, but there are multiple clinical trials that are offered at different levels, at different stage of the cancer. And we really want to reach every patient everywhere, everyone that wants to talk about research. There is hotline. We had a patient that shared the story in Miami Herald 2 weeks ago. And after that,
Um,
the phone kept on ringing, and there are patients from every cultural background that they call. And I think patients, I think there's a lot of myth about clinical trials, and I'm going to just go over a couple of them that are the most dominant that I get to hear many times a day. One is I don't want to be a guinea pig, and I don't want to get a placebo, and I don't want to take a chance. And so the guinea pig, right? Think about just the chemotherapy that we're using today. The most advanced is Adriamycin, Cytoxan, Taxol, right, for a non-HER2 positive cancer. And how did we get there? Well, comparing Adriamycin, Cytoxan with or without Taxol. How did we do that? Well, back then, when Adriamycin, Cytoxan was the best thing that we had, half of the people would just get that, and the other half were offered, do you want to try to add one drug to it to see if it's going to be better? What the news is, no one got placebo. The control arm got the standard of care for that day. So the ones that received the extra drug potentially could have gained a benefit or learn that adding another drug wasn't beneficial. So there is always a possible gain for those that participate. You potentially could get an extra drug that you wouldn't have otherwise that will increase your chances of being cured. And that's what happened. Those that received the Taxol in addition to Adriamycin, Cytoxan were the winners in the study, and therefore the study with the 3 drugs became standard for the rest of the people diagnosed with certain stage of breast cancer. So you could look at it different ways. You could say, well, those that went into research and they got the experimental arm were the winners. There is always that idea. That's why these studies are being done, because you're hoping you're going to come up with a better treatment than you had before you entered the study. So no one will get placebo, especially in the curative setting. The only time when you would think that somebody could get placebo, could get nothing, is if the cancer is so advanced that based on the standard of care, you have nothing that you think is going to work. And if you have nothing that you think is going to work, and the regular approach will be to give nothing, in other words, just to focus on quality of care of life and just give pain medication and make sure the patient lives comfortable, then that patient will not receive anything. And those patients potentially, if they go in a study, you would compare that nothing with the new proposed drug, and that would be a very early phase in a very advanced cancer. So I want to just everybody to leave with the one message. You don't get nothing unless the standard of care by the book potentially will include that option. That's how research is done. And research, we learn from mistakes that were done in the past, and nobody denies those. But the way that is regulated now, these patients that are on research, they're getting probably 10 times more attention because everything is so tediously checked. So why would one want to go in a trial? Well, you could get a drug that potentially could increase your cure rate before it gets approved. For you, that day matters, because usually when you give treatment for curative intent, you have a time frame that you're using. You're not going to go back 2 years from now and add Taxol to Adriamycin. It doesn't work that way. Think about the Herceptin story. When Herceptin was added to the chemotherapy backbone, it wasn't standard. It decreased the chance of a woman dying from breast cancer by half. It decreased the chance of the recurrence by half. Those that went on the Herceptin clinical trial and they got Herceptin, they were the one that got that improvement. So there are many, many reasons to go on a study, even when you look at it just from a personal gain. On the other hand, that's how we have the treatments that we have today, because people before us trusted the science. Talk about trusting the science, right? Like with the vaccines. Like, why do we have the COVID vaccine? Because some people trusted the science and they went on a clinical trial with the vaccine. And then we checked their antibody level and we saw that it's safe, and now everybody has the vaccine. So it's the same principle, you know. If you trust the science, if you look for a study that, you know, especially the phase 2 and the phase 3 studies, we already know the safety data from the phase 1. We already know the dose. So we have a lot of information, especially for the phase 3 clinical trials. They're very advanced. We know a lot. So in my opinion, and that's why I'm so passionate about research, because I've seen what it did, and I see the progress that we made over the last 3 decades. I see the lives that were saved because of research in the last 3 decades. And it's just the best thing you could do is to offer a patient a standard of care, and then as an alternative, a clinical trial participation. And if the patient wants to be a part of it, it's her or his right. If they don't, there is no pressure. But I'll tell you something, once people understand what it's about, most of them want to be a part of it. So I think, you know, the fear of whatever, you know, scary thoughts that are in blogs and other things are keeping them away. But once they get understanding of what it's about, most of the patients want to be a part of it.
I definitely agree. And, you know, I always think it's important to share like why it's so important is, again, the misconception, but really in all reality, it's helping us. It's helping the advancements, like you said, over 3 decades, right? I mean, without us, we're not going to make changes, right? We need women who are in active treatment, who are just diagnosed from all stages. And like you said, the various stages of the clinical trials, 1 through 4, like even post-marketing, right? Or collecting
Yeah.
data on healing, you know, as you're going through a mastectomy or there's so many different kinds of clinical trials. So thank you so much for going over that. You know, as we're getting ready to close out and really focus on survivorship, I do want to talk a little bit about what BRCA Strong has to offer our community and share with Dr. Calfa. And we do have some bigger news coming soon, which we will be launching. But, you know, just know that BRCA Strong is here to support you, whether it's through the educational aspect or it's through your support of your journey and being an advocate. We at BRCA Strong have created pre-mastectomy care packages for women prior to going in for treatment or for surgery. And these packages are made with care and sent with love, as we want every woman to be able to feel that they are not alone and to have comfortable garments when they come home and just comfy outfits just to hang out in around the house. So we are actually providing pre-mastectomy care packages, which include a post-mastectomy garment, 2 pillows, and a robe with drain belts, as well as we have another program called Bras for Brave Beauties, which is for lymphedema sleeves, prosthesis, and bras that the prosthesis go in. Many women don't know their options about healing garments, and, you know, we can't wear Victoria's Secret bras, you know, and we're done. But having these garments and helping you feel whole again is so imperative in a breast cancer journey, because we've always faced as women going through, you know, wearing bras or wearing, you know, cute little outfits, and those outfits and those bras don't fit us the same. Where at BRCA Strong, we have that to be able to provide you comfort. And the mental aspect, again, is I'm not just wearing a ripped t-shirt or a zipper down. We want to provide you comfort and healing at the same time, because it's not just healing from your incisions, it's healing from the inside out. And it really starts from your head mentally, as Dr. Calva said, it's from head to toe. So we're here to support you. If anything, you are more than welcome to apply for our programs on our website, as well as you can contact me by DM on Instagram. Lily, thank you so much for your comments. I truly appreciate your support, and I'm glad you received your package. As again, we want women. We are just as beautiful. We're nothing less without our breast. It's not just about the breast, it's about the woman. And from head to toe, let's really think of how we can help women and provide survivorship information, as well as little things that just put smiles on your face. But knowing that there's programs like Sylvester offers is truly a huge impact in our community. And I know many women who have gone through this program and are just so thankful that this program exists. So Dr. Kalfa, I'm really grateful for your time, you coming on and really sharing this information and letting women know what's out there and what your center has, talking about the advancements in clinical trials and what's really happening in our community. Because when you're diagnosed, and I'm sure you probably see it every day, women are so overwhelmed at where to go and what to do, and knowing that they have resources like Sylvester, like Braca Strong, and like these other nonprofits out there to help them make a difference, and powerful, inspiring, empowering physicians like yourself who are truly dedicated to sharing in our community and taking the time out from seeing your patients or doing procedures. We really want to thank you, and we're very grateful for your time.
Thank you so much, everybody. And Tracy, you're doing beautiful work in the community. And it feels like it takes a village, and we have the village. And again, it feels that way. And no one should feel alone in this. No one is alone. Even through COVID and all that, we're able to keep, some closing. And we're able to really, like, I joke when I say that I do my house calls, but this is how it felt when I was doing the telehealth. And it gave me the opportunity to see the patients where they are, see their grandkids, see their pets, see their faces, their smiles. So in a way or another, through COVID, we were able to pull together, and I hope our survivors feel the love, because we really want to have here something that you can count on every day. And if we can do better, I want to know about it. So just keep in touch. Tracy can share the contact if you ever want to. I'm on Instagram here. I usually don't do much on Instagram. This was my first Instagram live. So
Love it.
yeah, but thank you so much, everyone. And we'll see you soon, okay?
Definitely look at Sylvester, ladies, and their amazing programs. As Dr. Kalfa said, they offer weekly programs, 5 days a week. Those programs are amazing. I get the emails. I've participated in a couple. Look at the emails, sign up for their newsletters, and be informed and stay informed, because breast cancer doesn't quarantine.
I'm going to say one more thing, that Dr. Pinedo, who's a psychologist, a behavioral science expert, he's part of a huge grant to really look at the Hispanics and survivors in cancer. So there are going to be opportunities for people that are not our patients to join that trial. It's non-interventional. It's really learning more about the behavior. So if you hear on the news in Miami Health or so, just look out for that. You can be part of it, and you can change the future of patients.
Make sure you share that information with us, because I just started working with you guys on well-being for ovarian cancer, and it's not pharma related. It's on the well-being of ovarian cancer, and so many women have joined the trial and they said it's changed their lives. So anything we can do, any certain specific communities that we can target, you let us know. I'm always here.
Awesome. Bye, everybody.
Take care. Have a great
Thank
day.
you, Tracy. Bye.